Hi, I'm Virginia Bowen. I'm a rising junior at St. Joseph's Academy, and I got my vaccine after talking to my physician of my own choosing. It wasn't forced on me by my parents like so many other people think. But we talked with my mom, and I decided to get it. It was a good decision on my part, I think. So why should people my age get the vaccine?
So first of all, Virginia, I want to tell you how proud I am that you did get it, that you followed the advice of your physician, that might be me. And the bottom line is, right now, especially with the Delta variant being what it is, it's so contagious. Everybody who's out there is getting it. I've had as young as 2-month-olds, 9-month-olds, 6-month-olds, and they've all had it. It's just super contagious. And so with school starting back up, even though you're going to be wearing masks and all, there'll be times that you won't have your mask. So it's going to be great that you'll be protected. One of the things that we're hoping stays the way it is that if you are vaccinated, when you accidentally or without you knowing come in contact with someone who has COVID, you won't have to quarantine at home. You'll be able to stay wearing your mask, being very diligent about that, watching social distance, but you'll be able to still go to school, which we know as pediatricians is vital for kids' health, mental health, that is. They do so much better when they actually go to school. In England, for example, more children died of suicide than did they die of COVID, and it was because of the quarantining at home. I know that's going to be great for you and your friends. So how many of your friends have gotten vaccinated?
Most of them, actually.
Excellent. There's so many false things out there about it, like that it affects your fertility. I'm going to give y'all all a little insight into that. It hasn't been out there for the general public long enough for us to really test if it affects fertility. But even in the test subjects, it has not affected fertility or shown up in bad places or caused birth defects. It is a safe vaccine.
So when I first got the vaccine, the first thing that really struck me was that I could see my grandmother, who has cancer, without my mask on, without feeling guilty about it. Because the main thing about why it was so impactful on her life was because she had to stay 6 feet away. We couldn't touch her. We could touch each other because we had better immune health, but we couldn't touch her. She was sad and we were sad, and I think that getting the vaccine really helped her to recover from that.
So you're absolutely right about that. A lot of people ask me, well, why did you get the vaccine? Did you do it just because you're a doctor? And I told them, I have an 84-year-old mother who has lung issues, and I couldn't inadvertently bring it home to her, nor could I go in and see a newborn baby and accidentally give it to them. So when you get it, the vaccine, you're really doing it not only for your self-protection, but you're doing it for people like your grandmother, my patients, and it just makes everybody healthier when we're covered. And I'm going to be honest with you, it's so important, that touch. You see, I keep touching you in this interview, and it's because that's possible because you and I are vaccinated.
Thank you, Dr. Suki.
I love you even more.
Love you most.
And I love all of my patients, and I want you all to get vaccinated. 12 and above. We'll let you know when it comes for the younger people.